السلام عليكم ورحمة الله وبركاته. أقدم نفسي صيدلانية سمية غسان سامي، صاحبة بحث الدبلوم The Preparedness of Iraqi Public Health Care Setting and the Provider for COVID-19 Pandemic. المشرف الدكتور الأستاذ المساعد الدكتور علي عزيز، والباحث المساعد الدكتور محمد الركابي. نشكر كلية الصيدلة جامعة الكفيل على إتاحة هذه الفرصة لنا لعرض البحث. Background: The World Health Organization named the outbreak as coronavirus disease (COVID-19). On March 12, 2020, the World Health Organization declared as pandemic because of the rapid spread to more continents and highly contagious. SARS coronavirus infection largely presented flu-like symptoms such as fever, cough, and asthma. Now, the viral transmission. According to the reports of the World Health Organization, COVID-19 infection can be transmitted mainly through respiratory droplets. SARS coronavirus 2 can stay on surface for up to 9 days. However, they can be efficiently inactivated with 1 minute by surface disinfection. Additionally, social distancing of 1.5 meters is sufficient to prevent airborne transmission. About the preventive measure on general hygiene practices. In the first, wearing personal protective equipment such as face masks, gowns, eye protection, and gloves. Second, keeping patients isolated in quarantining room. The room surface and equipment should undergo a regular disinfection procedure. The significance of the study. Understanding healthcare providers and hospital preparedness can help to address the gap and protect healthcare providers as well as patients. Enhancing preparedness can save healthcare providers and patient lives in addition to containing the spread of nosocomial infection. Study objectives. The objective of the study was to measure the preparedness of public healthcare setting and the provider to face COVID-19 pandemic in Iraq. Methods. The type of the study. This was a cross-sectional study based on electronic survey in English distributed among healthcare providers. Target recipients: healthcare providers, pharmacists, physicians, and dentists working in public hospital healthcare setting across the country. The survey was distributed via professional Facebook group between March 22 to April 7, 2020. Exclusion criteria: healthcare providers who didn't work in public hospital or healthcare setting. The statistical analysis. Chi-square Fisher-Excel tests were used to measure the difference in hospital preparedness according whether the hospital has a diagnosis or treatment rule of COVID-19 or not. Independent sample t-tests were used to compare the total score means of healthcare providers and setting preparedness between hospitals having rule in the diagnosis or treatment of COVID-19 and those without this rule. The result of the study. The author received 347 electronic surveys. After excluding 30 healthcare providers who didn't work at public healthcare setting, 317 were included in the preparedness question. Most of them were pharmacists, 52% were pharmacists, 38 physicians, and 8.7% for dentists. The type of healthcare setting of the participants. Most of the participants, about two-thirds, were working in general hospital with emergency room, the other working in specialty hospital or in outpatient primary setting. The first part of the questionnaire was about the preparedness of healthcare providers. In general, all 7 items measuring healthcare providers' awareness of COVID-19 pandemic were above the average, with total mean of 27.9 out of 35 points, as shown in the figure. The second part of the questionnaire measuring the preparedness of healthcare setting. 10 out of 12 items measuring the preparedness of public healthcare setting to COVID-19 were below the average. Only 2 points, which are perform disinfecting procedure to all hospital units and hospital keeps suspected COVID-19 infection in an isolation room, were above the average. The third part of the questionnaire was about the attitude of healthcare providers toward the hospital rule to deal with COVID-19 pandemic. Also, most of the question was below the average. Only 3 questions, which are hospital has a role in the diagnosis of self-reporting COVID-19 cases, hospital has a temporary isolation room for COVID-19, and hospital examining both regular and COVID-19 suspected patients in the same emergency room were above the average. In conclusions, Iraqi healthcare providers has adequate level of awareness for COVID-19, while public hospital had inadequate preparedness measures. The hospital with diagnosis or treatment rule had better preparedness compared to hospitals that didn't have diagnosis or treatment rule. However, all had substandard preparedness measures. Recommendations. Thus, the public healthcare setting need to address the gap in the following: staff training, provide adequate personal protective equipment to healthcare providers, supply enough antiviral medications, and prepare trained staff to handle the large number of COVID-19 cases. Take-home message. Better preparedness and preventive measures in healthcare setting can prevent nosocomial infection and save patients as well as healthcare providers' lives, as the pandemic may last for long term. في النهاية نشكركم على حسن الإصغاء. الصيدلانية سمية غسان سامي.